In this video, I will discuss a real case that emphasizes why referring a patient to the correct specialty is so important. When patients choose to go directly to a specific specialty only for symptom relief, it can weaken the focus on establishing the correct diagnosis and planning comprehensive, evidence-based treatment. Healthcare should aim not just to relieve symptoms, but to do so in a thorough and guideline-based manner that addresses the underlying condition. A 38-year-old man came to the hospital with several years of chronic low back pain that had recently worsened. He underwent blood tests and an MRI of the lumbosacral spine. Elevated inflammatory markers, ESR and CRP, a positive HLA-B27, and characteristic MRI changes confirmed a diagnosis of ankylosing spondylitis. Your hospital has both an interventional spinal pain specialist and a spine surgeon available. Which specialist is the most appropriate to refer him to for managing his lower back pain? Let's discuss it. Lower back pain due to ankylosing spondylitis requires management primarily by a rheumatologist who coordinates a multidisciplinary care team. Interventional spine pain management and spine surgery are used only in specific rare circumstances. Ankylosing spondylitis is an inflammatory, autoimmune condition that mainly affects the spine and joints. A rheumatologist specializes in managing systemic inflammatory diseases and is best equipped to prescribe the necessary medications, like NSAIDs, biologics, and other disease-modifying drugs that target the underlying inflammation and slow disease progression. They coordinate the overall treatment plan, which includes physical therapy and monitoring for systemic complications. Interventional spine pain physician may be involved for symptom relief if standard medication management by the rheumatologist is insufficient. They might offer localized treatments such as targeted injections, like epidural steroid injections to manage severe pain flares, although these are typically adjunctive therapies and do not replace the systemic treatment. Guidelines often specify that typical interventional procedures for non-inflammatory chronic spine pain are not applicable to chronic pain associated with inflammatory arthropathy like ankylosing spondylitis. Management typically focuses on systemic inflammation control. Surgical intervention by spine surgeon is rarely the primary treatment for ankylosing spondylitis pain. A spine surgeon's involvement is reserved for specific, severe complications, such as severe spinal deformity significantly impacting quality of life, spinal fracture, or instability or neurological compromise. In summary, the cornerstone of management is with a rheumatologist for managing ankylosing spondylitis-related back pain, as the condition is an inflammatory disease requiring specialized, systemic treatment. They will determine if and when consultation with a pain management specialist or a spine surgeon is necessary based on the disease's progression and specific symptoms. So, it's neither interventional spine pain physician nor spine surgeon. This patient visited interventional spine pain physician for pain management without visiting rheumatologist despite refer.